Femoral triangle. What is femoral triangle? The femoral triangle, also known as Scarpa's triangle, is a crucial anatomical landmark in the upper, inner thigh. It appears as a hollow area, below the groin. It is defined by the inguinal ligament, on top, Sartorius muscle, on lateral side, and Adductor longus muscle, on medial side. This wedge-shaped space acts as a pathway for the femoral nerve, artery, and vein, along with lymphatics, moving between the pelvis and leg. This makes it vital for clinical procedures like accessing the femoral artery or treating hernias. What are the boundaries of femoral triangle? The femoral triangle's boundaries are defined by three structures in the upper thigh. The inguinal ligament, superiorly, forming the base. The Sartorius muscle, laterally. The Adductor longus muscle, medially. Thus creating a crucial anatomical space for nerves, vessels, and lymphatics. You can remember the borders with the mnemonic. Sail. Like sailing the boat. S for Sartorius muscle, that is, lateral. A is for Adductor longus muscle, that is, medial. And I is for inguinal ligament, that is, superior. What is the floor of femoral triangle? The floor of the femoral triangle is essentially a muscular groove, created by four deep muscles, providing a bed for the femoral vessels and nerve as they travel down the thigh. These four muscles are the iliacus muscle, psoas major, together forming the iliopsoas laterally, Pectineus muscle, and Adductor longus muscles. It can be easily remembered by the mnemonic APPI. APPI means elder sister in Urdu. We can use this mnemonic as A is for Adductor longus, P for Pectineus, P for psoas major, and I is for iliacus. These muscles forming the floor, from lateral to medial, are described as iliacus and psoas major, collectively called iliopsoas. These form the lateral, outer, side of the floor. Pectineus. It forms the medial, inner, part of the floor. Adductor longus. It also contributes to the medial aspect of the floor. Roof of femoral triangle. The roof of the femoral triangle consists of three layers from superficial to deep. Skin. Superficial fascia. Deep fascia. These layers cover the major structures like the femoral artery, vein, and nerve, making it a key area for medical access and palpation. It is described in detail as skin. It is the outermost layer. Superficial fascia. It contains fat, and the great saphenous vein, which pierces it. Deep fascia, also known as fascia lata. It is a strong, deep layer of connective tissue that forms the main part of the roof, with the saphenous opening for the great saphenous vein to join the femoral vein. What are the contents of femoral triangle? For the femoral triangle's main neurovascular contents. Lateral to medial. We can use the mnemonic NAVEL, like our belly button. We can use this mnemonic as NAVEL. N is for femoral nerve. A is for femoral artery. V is for femoral vein. E is for empty space that has femoral canal and lymphatics. L is for lymphatics or lymph nodes. These contents are described from lateral to medial as femoral nerve. It provides motor and sensory innervation to the thigh. Femoral artery. This is the main artery supplying the lower limb with important branches. Femoral vein. It drains venous blood from the lower limb. Femoral canal. It is an empty space containing deep inguinal lymph nodes, lymphatics,